I've been working with NGOs my entire career and came to academia late in my career, but I've been for the last decade leading a massive effort to look at the effectiveness of community-based primary health care and improving maternal, neonatal, and child health. And we've identified 702 articles in which a community-based intervention or set of interventions was implemented at the community level in which they assessed the outcome in terms of population coverage of evidence-based interventions or nutritional status or serious morbidity or mortality. And we've looked at the various processes that were used by these studies to achieve their positive result. And we're real excited about this study because it's the most comprehensive study of its type that's out there now. Results will be published in an open access journal called the Journal of Global Health in a few months. So our review focuses not only on the interventions, of which there are quite a few now that are effective at improving maternal, neonatal, and child health, but also the ways in which they're delivered and the other associated processes that are important for achieving a positive result. And so I think some of the exciting findings from this are, number one, the importance of home visits for delivering interventions. We know, a lot of people know about integrated community case management as an effective approach. And also, fewer people know about participatory women's groups and their effectiveness in improving maternal, neonatal, and child health. There are two forms of these groups. One is called participatory learning and action groups, which is where a facilitator goes and meets with women in a village on a monthly basis and helps them understand the causes of death and serious illness among mothers and newborns and helps them to think about how they can reduce those risks. And those have been shown to be effective in improving maternal and neonatal mortality. And then the core group and its members have been pioneers in developing care groups in which a facilitator meets with a group of 10 or 12 volunteers, each of whom is responsible for 10 households. And the care group meets every 2 weeks or so, and they learn a new message that they share with their 10 households. And also, if there's a newborn there in that group, then the care group volunteer gives special attention to the newborn. And those have proved to be very effective in expanding the coverage of interventions and reducing mortality in children. And so we have home visits, integrated community case management is two delivery strategies, participatory women's groups. And then the fourth one is the provision of services by outreach teams that are based at peripheral outreach clinics. Mobile teams that go out to provide immunizations and so forth. So we'll be emphasizing how important those are. But also, our review will be describing all the various forms of community engagement that have been used by these studies, from engaging with community leaders to women's groups within the community, engagement with religious leaders and already existing groups within the community to help them become participants in the care process. So we have the delivery strategies for the interventions, we've got the community engagement piece is being highlighted by our review, and then the third part we're focusing on is the strategies that were used in these projects to strengthen the health system and their engagement with the community, and those involve efforts to improve the drug supply and logistical support for community health workers, which is a serious issue all around the world. Improving supervision and training supervisors to support community level work, strengthening referral systems, and training of providers at peripheral health centers too, to support community health level work. So this broader set of packages that are important for making interventions effective will be an important part of our review too. We have an expert panel that was created to guide this review, and it was established 10 years ago, and they'll be reviewing our findings and they'll be submitting a report that'll be part of our journal supplement. So this is led by world-class people who are well known for their commitment to and support of community health work around the world. So we think this is going to be an important contribution to furthering the cause for community health and community-based primary health care.